Folks, today is National Black HIV/AIDS Awareness Day, and this disease still has a fundamental impact on African Americans. In fact, the CDC previously reported, as we reported last year, that 1 in 2 black men who are gay will get the HIV virus. That is a stunning number. The question is, what is being done to halt this? What is also being done to drive resources to African Americans as well? Right now, this year's theme is "I am my brother's sister keeper, fight HIV/AIDS." And so, of course, blacks account for 58% of all new HIV infections among adults and adolescents. Among all African Americans diagnosed with HIV in 2014, 73% were men, 26% were women, 57% were black, gay, or bisexual men. African American women led women of all races who were diagnosed with HIV in 2004. Joining us on the phone is Dr. Eugene McCray, Director of the Centers for Disease Control and Prevention's Division of HIV/AIDS Prevention. Dr. McCray, first and foremost, we reported the CDC numbers, but the question still is, are the resources being properly targeted to African Americans, especially places in the South? I'm here in Pine Bluff, Arkansas, and the CDC had a report several years ago showing the explosion of HIV/AIDS in the South, even on HBCU campuses.
Good morning, and thanks for having me on your show. Let me start by just saying that the NBAD, our National Black HIV/AIDS Awareness Day, is an important moment to really build a bunch of successes that we've had, as well as close the gaps in fighting HIV in black communities. But specific to your questions, we've made tremendous accomplishments over the last years targeting black communities and the South in terms of reallocating resources and having very targeted efforts that are addressing HIV in the black community, specifically among black women and among black African American men, especially men who have sex with men. And those results, those targeted efforts have yielded results, but good results. For example, women, we're seeing tremendous declines in HIV. Black women, for example, we've seen tremendous declines in HIV over the last 5 years, and such that the gap between HIV diagnoses in black women and white women is closing. However, we still have progress that we need to make, because black women still account for about 16% of people who women who are living with HIV. I'm sorry. African American women are about 16 times as likely to receive an HIV diagnosis than white women.
All right. One of our panelists has a question. That's Tiffany, you first.
It's really, really alarming, and Roland, I'm really glad that you asked the question around resources that are being directed into the community. That's a very important question. We can talk about alienating people all we want to with this disease, but when we talk about the treatment for it and the access to that treatment, that's a very critical question. My question is, for folks who are asking or want to know the questions around the best and the most affordable ways to get access to this care, or for testing, which is what we need to talk about for today, what, I guess, are the different resources or avenues that folks can take the first step into finding that information out? Do they look online to a website? Is there a particular, book that they should read? What are the resources that you advise folks to look into today?
People can certainly start by checking out the CDC HIV website, cdc.gov/HIV. But in each of your state health department will also have websites that you can go to that will tell you in each of your states what's available in terms of where you can go to get tested, both in clinical and non-clinical settings. And then, of course, there is also AIDS.gov, which is another site that you can go to that can tell you about where you can get tested. So there are many resources out there available for people to learn where they can go to get tested.
And all those testings are free, right?
For most of the testing is free, but if you go to your private provider, if you get tested by your private provider, they may charge you a fee or charge your insurance a fee.
Got it.
Gianno, real quick, you have a question?
Yeah, so we know that George Bush put a lot of money in HIV/AIDS prevention, and that's something that we know. Did President Obama build on that, and what can people do who perhaps want to give for the fight against HIV?
Yes, as early I stated that we've made a tremendous progress in HIV prevention among African Americans in recent years, largely due to a number of contributing factors. One of the things that did happen, ACA did help us increase HIV testing and treatment, and those are all important things. But the thing that I can say is that the numbers continue to show that African Americans are more affected by HIV than any other racial ethnic groups in the nation. And among African Americans living with HIV, too many are not getting the treatment that they need. So the findings that were mentioned earlier really underscores the importance of us to continue to do HIV testing, treatment and prevention among African Americans to help us continue to advance the fight against HIV that we've made tremendous progress in over the last 10 years.
All right, Dr. McCray, we surely appreciate you joining us here at TV1. Thanks a lot.
Kickstart your day at 7 and get the news you need from the perspective you want. NewsOne Now with Roland Martin, every weekday morning at 7 on TV1.